Hello, today I am going to discuss on differences between tympanic and eticanthal type of chronic otitis media. This is very commonly asked question in MBBS as well as in MS ENT practicals as well as in theory. Therefore, you should know the differences between eticanthal type COM squamous disease and tympanic type chronic otitis media mucosal type of disease. You should be able to differentiate chronic otitis media squamous disease from chronic otitis media mucosal disease simply by the quality of discharge or otorrhea. Otorrhea in case of COM squamous type or eticanthal disease is scanty because in the posterior superior area or in the etic area there are less of the goblet cells. It is continuous because there is continuous low-grade infection going on in eticanthal disease. The discharge is purulent due to pus-forming organisms, occasionally blood-stained because of presence of granulation tissues, and it is foul smelling because of anaerobic infections. In contrast, the discharge in tympanic disease is profuse because of presence of goblet cells in the middle ear cavity towards the eustachian tube area, that is respiratory epithelium, which is intermittent. There is not continuous infection. The infection increases when there is chance of URTI. When the child or when the patient has common cold, the infection might spread from nose and nasopharynx to the ear, leading to the chance of infection. It is mucoid because of goblet cells again. It is not blood-stained because there is very rare chance of formation of granulation tissues in cases of CSOM tympanic type, but sometimes it might happen. And the discharge is non-foul smelling because most of the times there is no anaerobic infection and there is no bone erosion. Foul smell is basically due to bone erosion by anaerobic organisms and their enzyme actions. Next is the perforation. Perforation in eticanthal disease is etic perforation or marginal perforation of pars tensa. Sometimes there is retraction pocket, which is the major cause for chronic otitis media eticanthal disease. Whitmark's retraction pocket theory holds very good for causation of COM squamous disease. In case of tympanic type, there is a central perforation of pars tensa. Next point, cholestatum or granulation tissue are the hallmark of eticanthal disease, whereas there is no cholestatum and granulation tissues in case of CSMTT. Perforation of pars tensa, central perforation is the hallmark of tympanic type along with conjunctive hearing loss. Eticanthal type is also called as unsafe disease because it can lead to complications due to bone erosion, and tympanic type is called as safe disease because there is very less chance of complications due to this disease except perforation of pars tensa and hearing loss. In eticanthal disease, there are high chances of complications because, as we have already told, the disease can extend from the ear to other surrounding areas due to bone erosion or sometimes by the blood vessels. The chance of complications in tympanic type is rare. It is also called as safe disease. Chronic otitis media squamous type or eticanthal disease is treated by mastoid surgery, might be modified radical or radical mastoid surgery. But tympanic type disease can be treated by myringoplasty or tympanoplasty. These are the salient features of eticanthal disease from tympanic type disease in case of CSM, chronic suppurative otitis media, or chronic otitis media, squamous and mucosal disease. I hope you have understood the basic differences and the reason for different types of otorrhea. This is very commonly asked question in the exam. Please go through it. Thank you. Thank you very much.